Hi everybody. Today we'll have another very important topic, that is seizures and status epilepticus, which we regularly see in our ICU emergencies. So it is not only a neurological problem but also a medical problem, because it is a symptom which is associated not just with problems related to neurological pathologies but also due to various medical pathologies. So the incidence rates of generalized clonic status epilepticus ranges from around 3.6 to 6.6 per 10,000 population in European countries, whereas in American countries or in West, range is much more higher, that is around 41 per 100,000. And it is associated with a high mortality, that is around 17 to 26%. So what is the definition of status epilepticus? Traditionally, it was defined as seizures for more than 30 minutes, that is 30 minutes of continuous seizures activity, or 2 or more sequential seizures without full recovery of consciousness between these seizures. But the recently updated definition as per the ILAE, that is International League Against Epilepsy, have given a much more precise and a very simpler definition, that is a continuous seizure activity for 5 minutes or more without return of consciousness, which has to be highlighted. There should not be any return of consciousness in the 5 minutes, or there are 2 or more seizures, that is recurrent seizures without an intervening period of neurological recovery. That is, in between one seizure and another seizure, the patient does not come back to his baseline neurological status. So, few more definitions. After a status epilepticus, we reach to a state which is called as refractory status epilepticus. So, this occurs when seizures persist despite administration of first line of medications. That we'll come to know later what are the first line of medications. But after you have administered the first line of medication and the entire first line of medication, and then you reach the second line of medication, and in that, even in spite of administering one of the second line of medication, if the seizures persist, it is called as refractory status epilepticus. Then we have super refractory status epilepticus, which is defined as status epilepticus that persists despite 24-hour treatment with the IV anesthetic. That is, this IV anesthetic is a third line of treatment. So, despite giving an IV anesthetic infusion for 24 hours, the seizure is persisting, or the seizure gets terminated with the IV anesthetic infusion but recurs when weaning the patient off the anesthetic. Then you have a NORC, which is a newly defined term which is more predominantly used in pediatrics. That is the new onset refractory status epilepticus. It is defined as a new onset RC where no discernible cause is identified in otherwise a healthy individual. It is an idiopathic status epilepticus. You do not expect in that patient for the status to or seizures to appear. Hence, no etiology is not being defined. So, now let us see about the classification of status epilepticus. Now, classification is 2 different categories. One is based on the AXIS system, which is the International League Against Epilepsy, and the second is a simpler classification, which is Tryman's classification. So, first let's see the ILAE classification, which classifies status epilepticus into 4 categories based on your semiology, etiology, age and the EEG findings. So, you must be wondering what is the semiology. Semiology is the classification of status epilepticus predominantly on their motor symptoms or the impairment of consciousness. For instance, we have convulsive status epilepticus, non-convulsive status epilepticus. Then among convulsive, we have tonic movements, clonic movements, myoclonic jerks. In non-convulsive status epilepticus, we have like only eyeballing or impairment of consciousness or akinetic mutism, all those things. So, based on the symptomatology or the features through which the patient presents, this status epilepticus is the axis which is defined as semiology. The second is the etiology. So, we know that the etiology can be neurological etiology like a stroke, a hemorrhage, trauma or meningitis, or it can be even a metabolic etiology, uremic encephalopathy, hepatic encephalopathies, or dyselectrolytemias, hypoxic encephalopathy. So, based on the etiology, the status epilepticus will be defined. Then, based on the age, neonatal onset is up till 1 month, infancy up till 1 year of age, childhood, adolescent and elderly. At what age your status epilepticus is predominantly seen. And based on the EEG findings can be based on the frequency with which it occurs, the pattern of the waves present, or the types of waves, the alpha overactivity, beta overactivity. So, based on these EEG findings, again the status epilepticus. So these are the 4 axes, that is the semiology, etiology, age and EEG findings. This is not very important as per critical care aspect of view, but for definition you might have an idea about it. Then there is a much more simpler classification which is called as Tryman's classification, which divides status epilepticus into 2 types. Simpler one, convulsive status epilepticus, non-convulsive status epilepticus. So we already studied that convulsive status epilepticus is continuous seizure activity for 5 or more minutes without return of consciousness, or there is a recurrent seizures or 2 or more seizures which is continuous without, and in between the 2 seizures there is no neurological recovery or the patient does not return to its baseline neurological status. So what is non-convulsive status epilepticus? In an NCSC, it's a state where the seizure activity is evident on the EEG, but definitely there are no obvious clinical manifestations like any myoclonic jerks or any motor activity other than obtundation of the neurological status or coma. The duration of this will be minimum 30 minutes. These are like, it can be in an absence seizure wherein you see like patient is completely mute and is not aware of what is happening to the surroundings. It can be a simple partial seizure without loss of consciousness or complex partial seizures with loss of consciousness and without motor symptoms.